Your dog's collapsed and they're not breathing, what do you do? Every dog owner should know CPR, so save this video to your favourites because you don't know if and when you might need it. Now, if you found a dog that's collapsed, they're not breathing, you need to perform an initial assessment. You need to remember A, B, C. A is for airway. Open up their mouth, pull that tongue out, check their airway. Is it clear? If it's not clear, if there's something obstructing it, you need to try and remove it. Ideally using one finger in a swooping motion, get behind the object and pop it out. If it's a ball or it's something that's gone in quite deep and you cannot remove it with that one swooping finger motion, pop the dog on their back, extend their neck. Using your thumbs, you need to push the item up and out the airway to remove it. Once the airway is clear, you're moving on to B. B is for breathing. Get down to face level with the dog, look at their chest. Can you see it rising and falling? If you can't see it rising and falling, put your cheek to their nose. Can you feel the breath on your cheek? Can you hear that they're breathing? Take a look at their gum colour. Are they going blue or purple? If they are, there's already oxygen deprivation. So moving on to circulation, which is C. Hand on the chest, can you feel their heart? If you can't feel a heartbeat, 2 fingers on the inside of the upper thigh, can you feel a pulse? If there's no pulse, there's no heartbeat, they're not breathing and they're going blue, we need to start CPR. If you haven't already, call your vet just to alert them of the situation. They should be able to provide you with advice on the phone, but in the meantime, lay the dog out on a flat, hard surface, ideally on their right hand side. If they're laying on the left hand side and you're unable to flip them over, don't worry, just continue with them on the left because any CPR is better than none. Now, to start the compressions, you want to interlock your fingers, lock your elbows and have your shoulders directly over the dog. You're going to be using the heel of the palm of your hand, but where you place this varies on the type of dog that you're giving CPR to. So for round-chested dogs like Labradors, Golden Retrievers, you want to place your hands on the widest part of the chest. If it is a deep-chested dog like a German Shepherd or a Greyhound, you want to place your hands directly above their heart. A dog's heart falls just behind their elbow, so if you bring the elbow back, where that naturally lands is where their heart is. So for deep-chested dogs, that's where you want to give your compressions. If they are a wide-chested dog, like an English Bulldog, you want to put them on their back and you give your compressions directly in the middle of their sternum. For this example, I'm going to continue as if it is a deep-chested dog, as if it is a German Shepherd. So we're going to interlock our fingers, lock our elbows straight, shoulders right above, my hands are above the heart. I'm using the heel of my palm directly above the heart. You need to give 30 compressions and you need to give them at a rate of 2 compressions per second. Some people find it easier to do this to the beat of Staying Alive, but you need to give 30 compressions. You need to compress 1/3 to 1/2 of the depth of the dog's entire chest depth. I know it sounds a lot, but it is necessary. So given those 30 compressions, once you've finished those, you need to give 2 breaths. Keeping the dog's tongue inside the mouth, use your hands to completely surround and close the mouth, creating an airlock. Put the dog's nose in your mouth and give 2 breaths. Check after every breath that that chest is rising to make sure that they are getting sufficient oxygen in there. Go straight back to those 30 chest compressions. You need to continue a full 2-minute cycle of CPR between the chest compressions and the breaths before you stop to check, are they breathing? Is there a heart rate? Can you feel a pulse? If the answer to those 3 things is no, resume CPR for another 2 minutes and then check again. If at any point the dog starts breathing, you can feel a heartbeat or there is a pulse, then stop CPR and get the dog to the vet as soon as possible. This kind of CPR is used for dogs over 7 kilos. Small dogs and cats have a different method of delivering compression, so I'll do a different video to teach you that one. But in the meantime, if you haven't already, please do save this video, share it with any of your other friends that have dogs, because I genuinely believe every single dog owner should know CPR. You might need it for your dog, you might need it for someone else's dog, but knowing CPR could save a life.